So how hard was surgical residency? Was it really that hard? In this video today, I'm going to be talking about my experiences as a resident and was it hard? What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. For those that are new to the channel, welcome. My name is Dr. Antonio Webb, an orthopedic spine surgery fellow. Make sure you hit the like button and make sure you hit the bell notification so you don't miss any videos that I put out every week. Alright, so how hard was surgical residency? Was it that hard? Well, the answer is it was extremely hard. It's probably one of the most challenging things that I had to do for a number of reasons. Number one, I think the transition from medical student to intern was challenging. It was challenging in the fact that as a medical student, you're protected. You have senior residents, you have staff that are around. They kind of baby you along this process. Where you are in the hospital, you're usually assigned patients as a medical student. That can be 1 to 2 patients, maybe 3 patients on a surgical rotation. Your responsibility is to look up their labs, look up any imaging studies that they had, like a CT scan or MRI, look up their clinical history, go interview the patient, and then you present the patient in front of your peers to your staff. So going from 1 to 3 patients max as a medical student to my first rotation as an intern on general surgery, I had 20 plus patients. And even though we had some mid-levels, PAs, as well as nurse practitioners, I still had a lot of patients to look after. This was weeks after graduating from medical school. So that was challenging in the fact that you had to manage all of these patients. One patient may have appendectomy, another patient may have been a gunshot wound to the belly who had a colostomy. You're following and recording their output from that colostomy. Another patient may have diverticulitis and ended up getting a bowel perforation. Another patient may have an abscess somewhere in their body. So lots of different patients, and a lot of these patients in general surgery were pretty complex. I remember as an intern being up on the surgical floor, seeing the patient. I had 2 cell phones, I had 3 pagers. One of my pagers was going off saying there's a trauma in the ER. Another phone call from a nurse saying, hey, this patient is up here is having chest pain. Another call from a consulting service saying, hey, we have a consult for you guys to see, which means other services in the hospital will call other services to go see patients for that particular specialty. Say, for instance, I'm doing a general surgery rotation, and let's say ENT has a patient who developed abdominal pain and has an ileus, which means your bowels are not working and you need to put an NG tube in, give them IV fluids, make them NPO, which means nothing by mouth. Well, as a general surgery intern, you're usually the person going to see that patient. So you're doing a lot of scut work. It's a lot of paperwork, running things here. If your chief resident say, hey, go do this, well, you better go do that. So it was pretty challenging to manage and juggle and make that transition from a medical student to an intern medical doctor. The second hardest thing while I was a resident was actually balancing work, life, everything else outside of that. So as a medical student, you're really stressed. You have all this information that is thrown at you. You have to memorize lots of information in a short amount of time. You have to do research, you have to do clinical rotations, you have to be at this meetings. So you feel like you have no time whatsoever. Well, as a resident, that amount of time that you thought you didn't have is amplified by 10. You definitely do not have any time because you're working 80 plus hours a week. You're still required to go home and study. You're still required to do research. You're still required to have some social life. So that was the most challenging thing, I thought. Finding how much time do you actually need to study? How much time do you need to spend preparing for cases? How much time do you put in doing research? And doing all of these things at once and trying to juggle all of them was pretty challenging. I suggest that before you start your week, you make a plan of what you need to accomplish. Each day before you go to bed, you want to make sure that your list that you made I need to read this chapter, I need to do these questions, I need to start on this research project. At least those things are started before you go to sleep. Because as a resident, no one is going to sit there and tell you, hey, you need to go home and study. What's going to happen is, once your in-training exam is a 8-hour exam that we take every year as residents, once that exam comes up, you should have studied for that entire year by yourself. So there's a lot of self-motivation that is needed. You need to go home and study, make yourself go read this article, make yourself go prepare for these cases so that you're prepared for work as well as for your exams. The next hardest thing was the increased responsibility and autonomy as a surgical resident. As an intern, you're kind of babied into the resident life. You have chief residents, you have senior residents there to ask questions that can help you when you are struggling or don't know what to do. You have staff that you can talk to as well. Your second year, you get a little bit more responsibility, a little bit more autonomy. Maybe you get into the operating room and you get to just watch, hold the retractor, get pimped, ask a lot of questions during surgery, so you have to read and prepare for those cases. As a third year, you get to do a little bit more. In the operating room, you may be doing the surgery with the staff surgeon or the chief resident, and they're walking you through the case and saying, hey, this is how you do the surgery, this is where you make your incision, this is what nerves and blood vessels that you need to watch out for, etc., etc. But as a fourth-year resident and a fifth-year resident, in some surgical programs, there are 6-year residents and 7-year residents, you're expected to behave like a staff attending. You're usually the chief resident, which is the top resident. You have 20 plus residents that are under you, that are looking up to you. So when it's time to do a surgical case or to work up a patient that has a weird condition or diagnosis, you need to know what to do. And that's a lot of responsibility, especially if you go to a program where your staff are kind of hands-off. By the time I was a fourth year or a fifth year, I was doing surgeries in the middle of the night with staff that were present. They were around, but I was in the operating room doing the case. If I was doing a hip replacement or if I was doing a knee replacement or fixing someone's broken femur, I have to know the steps of that surgery. I have to know what to do when something goes wrong. I have to know how to manage that patient in the post-operative period. When should I let them start weight bearing, which means walking on their leg? What medications I'm going to give them to prevent blood clots? What are the side effects of those medications? What happens when this patient in the post-operative period complains of chest pain? You have to know how to manage all of those things, and that's why training to become a doctor is so long, because there's so much to learn in just a short amount of time. So those were the most challenging and hardest aspects of being a resident. Now don't get me wrong, I love what I do and I don't want this video to discourage anyone from going into the field of medicine, but you must realize what you're getting into. I suggest a couple things. Number one, take it day by day. This is a long path, this is a long road. Treat it like a marathon, not a sprint, because some days you're going to feel burnt out and stressed out and frustrated from the day not going as well as you have liked, and you're just going to feel like you just don't want to do it anymore. I suggest also finding a mentor, someone that you can talk to when you need to make those decisions to further the next step in your career. And whether this is applying to fellowship or what books and resources to use to study, I think it's essential to find someone who's already been through that path, who's a chief resident or who's a couple years ahead of you or a couple months ahead of you, and say, hey, what do I need to know at about this point in my training? What do I need to do to get to the next step? So yes, surgical residency was extremely hard, but it was doable. I always look at things in medicine and in life in general as if someone before me did it, I can do it also. So if I can go through surgical training 5 years and still do well, get into a top fellowship and still excel as a resident, you guys can also. You just have to put in the work, you have to work really hard, keep your head up, and just know that it will pay off in the end. This is Dr. Webb. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.